record. And now I will make the Maram the host. There we are. Over to you, my dear Dr. Maram.
Thank you very much, Father Peter. Let me just get my stuff together. Sorry. One second.
Take your time.
Yeah.
I will say that after we've had the presentation, we will have time for a discussion, short discussion, where I want us to think about what we've heard, and especially to think about the experience of people with autism in our church. We have many, the experience of their families, and how we can better support them as congregations. Now I'm going to be quiet. Please make sure all your microphones are turned off. And
Hi, everyone. Sorry, Father Peter. Sorry, it took me a while to sort this out on my laptop. Sorry. Thank you very much for inviting me today, Father Peter. And I'm just going to talk a little bit about autism spectrum, just touching the surface, really. I've tried to make the talk as non-clinical as possible. But do forgive me if there is a bit of medical jargon, and I'm sure there'll be time for questions and discussions at the end. I suppose the main point in doing this presentation is for us to think together about how we can support members of our congregation who might have this condition and how we can support their families. But I also wanted to try to raise some awareness about it and reduce the stigma that surrounds the condition, because I think it's quite strong, especially in our cultures. So first of all, what is autism? So let me just clarify a bit about what it's not. Autism is certainly not a mental illness. In fact, it's not an illness at all. It is not an intellectual or learning disability either, although autism can frequently co-occur with a learning disability or an intellectual disability, but they are not one and the same. And autism is a neurodevelopmental condition, which means that it relates to the development of the brain. And it's a lifelong condition, which starts in very early childhood. So in the very early stages of brain development, but it may not be recognized until much later. So why is it called autism spectrum condition or disorder? Why spectrum? This is just to emphasize that there is a significant variation in how different people or different children with autism present. So no two children on the spectrum are the same. So each child will show some, but not all the characteristics of the condition. And different children will show these characteristics to varying degrees of severity. So spectrum also means that autism is not a linear condition. So there's no such thing as a child who's less autistic or a child who's more autistic or a child who's very autistic. And we don't use terms such as high functioning or low functioning autism anymore. These are obsolete. So one child might have significant difficulties with social communication and social interactions, but not have severe difficulties with their executive functioning, which means how they think about things, how they plan for things, how they problem solve. And another child might have significant problems with sensory sensitivities, but might not be too bad with social interactions. So what causes ASD? There isn't a single known cause for ASD, but we know that there is a strong genetic factor. It does run in families and there is a high heritability. There are certain things that can increase the risk of a child being born with autism. So certain infections or certain medication that the mum might take during pregnancy might increase the risk of the child being born with autism. There is also a higher incidence of autism in children who are born premature or with a low birth weight. Autism is certainly not caused by bad parenting. Parenting has nothing to do with the development of autism, and it is definitely not a curse or a punishment. Although in our cultures, I think this idea might still be quite prevalent. So how do we diagnose autism spectrum? So to diagnose it, the child must have these two domains of difficulties. So the first one is an impairment in social communication and interaction. And the second is restrictive and repetitive patterns of behavior. And these must be present across all settings. So you can't diagnose a child with autism if they only show difficulties, say, with social interactions at school, but they're completely fine at home with social communication and interaction. Although you must take into account that they might show the difficulties differently, depending on the context and the environment. So there will be difficulties, but they might just show them to a different degree, depending on where they are and how safe they feel. So the first set of difficulties is the social communication and interactions. This is very different from speech or language impairment. So the child might not have any speech delays. They might not have any difficulties with their development of speech or language. They might be very articulate, but it's the use of language to communicate socially that is difficult or impaired. So they will show difficulties with reciprocal social conversation, which means chatting to and fro might be very, very difficult. So children with autism will often talk at you rather than with you, and they have significant difficulties with small talk or chit chat. But if you get them to speak about a topic that they're really interested in, they might come across as very articulate with absolutely no difficulties with conversation. They will also have difficulties with integrating spoken language with non-verbal cues. So things like eye contact. It's present, it might be present in children with autism. They might be able to make eye contact, but it's the difficulty with integrating that with what they're saying or how they're expressing themselves. Things like facial expressions might not be well integrated as well with what they're saying, and body language. Children with autism have limited social awareness, and this doesn't improve naturally as they develop or grow older. So they might still continue to make what we would consider socially inappropriate comments in public when they're much older. So say, for example, in a 5-year-old, it might be socially acceptable for them to make a loud comment in public, say in a supermarket or something about someone who's overweight, but that's obviously not socially appropriate in someone who's 10 or 11 years of age. In autistic children, it doesn't change as they grow older. This social awareness doesn't improve naturally. They have difficulties with their ability to read other people's feelings and intentions, and that makes them quite socially naive and socially vulnerable. And they have difficulties sharing interests with their peers, and that is part of the difficulty in making friends or keeping friends. So a lot of the time, children, especially older children and teenagers, don't lack the desire to make friends or keep friends. They have this wish to socialize, but it's just that they lack the ability to do it in a way that is acceptable to their peers. The second domain of difficulties is the restricted and repetitive behaviors and interests. So children with autism are very routinized. They like sticking to routines. They thrive on routine. So for example, if you change the route that you take from home to school, which they're used to taking every day, if you change that without warning, that might throw them. It might cause a lot of frustration, a lot of anxiety. They tend to like punctuality and precise timings. They like to know exactly what time something will start, exactly how long it's going to take and what time it's going to end. And if you promise them, for example, that you're going to start something at 1 o'clock and you start at 1:15, that might cause huge problems. It might be difficult to accept that change without anxiety and frustration. They have a lot of resistance to minor changes. So say, for example, at school, they might find it very difficult to accept a change in the seating plan in the classroom without warning. So if there is a plan to do that, they need to be given advance warning that this is what's going to happen in school and this is why it's going to happen. Otherwise, it will really throw them. And they like to have things done in a very particular order. So for example, the morning routine before they go to school has to be done in the exact same order every morning. Otherwise, that will cause a lot of anxiety. They like to stick to rules excessively. So that might cause problems with their peers when they're playing games because of the lack of flexibility. They often have rituals that to us might seem purposeless. So for example, they might like lining things up. So for example, for boys, they might like lining their cars up or sorting things, for example, according to color or shape. And they have repetitive movements. This is much more common in early childhood. It tends to decrease as the child grows older. So things like rocking, flapping, walking on tiptoes, these usually serve to soothe the child. They also usually have persistent preoccupations with things. So they will have a special interest. So for example, with boys, you might have them really, really interested in football, and they might go away and research everything to do with a particular football club and gather lots and lots of information about this particular football club. And whenever they see their friends or their peers at school, they'll only talk about this interest. It can vary with time. So as they grow older, they might develop another interest, but it's usually quite unusual in its intensity. They might have preoccupations with parts of objects, especially younger children. So again, with boys, they might like to spin the wheels on a car. So if you buy them a car, they will immediately focus on the wheels on the car rather than show interest in the car as a whole. And they might have interests in certain characteristics of people or things. So when they first meet people, they might go to smell them. Just because they're interested in smells in general. About 90 to 95% of individuals with autism will have sensory differences. So this could be either increased or decreased sensitivity to stimuli, such as lights or sounds or textures of things, including food and clothing. And sensory differences can interfere with the child's ability to sustain their attention. So if, for example, they're in a classroom that's a bit loud or the other children are being a bit disruptive, they will have significant difficulty paying attention in that environment. And that can cause a lot of anxiety, which usually manifests in the form of meltdowns or outbursts. The child isn't going to come up to you and say, oh, I'm worried because, or I'm anxious because it's too loud. That they're never going to be able to express themselves like that. What you will see is the meltdowns and the outbursts. So even though autism is a neurodevelopmental condition which starts in very early childhood, it is often missed and recognized quite late. This is especially in females, girls, and in highly intelligent children and young people who are able to mask their difficulties and get by, for example, mimicking their peers, watching how they act and copying them. Girls in particular are very good at doing that, much better than boys. Girls also tend to fall under the radar because they express their anxieties in different ways. So rather than getting angry or aggressive, they tend to withdraw or leave the place or avoid certain situations. So autism tends to, we tend to get a very high number of referrals in years 7 and 8 when the child transitions to secondary school, because it's then that the social and academic demands exceed the child's limited capacities to cope. So in primary school, because the children have grown up together since nursery, they tend to tolerate each other and tolerate the differences in each other. But when this child moves into secondary school, where they don't know anyone else and they're expected to start making new friends, that's when all the difficulties start to become very obvious, and they usually become quite overwhelmed and find it very difficult to cope. So autism is not a mental illness, but there are certain mental health conditions that occur much more commonly in autism than they do in the general population. So the most common mental health problem that occurs in children with autism is anxiety. This occurs in about 40% of young children with autism. It's because of a number of factors to do with the core features of autism. So number one is their frustration with their inability to communicate socially. So their frustration with their inability to get across what they need or what they want, that can cause a lot of anxiety. Their anticipation of difficulties in social gatherings can cause a lot of anxiety. Also, their difficulty to cope with change or with any kind of uncertainty or unpredictability. So during the pandemic in the last 2 years, we had a huge spike in referrals, mainly referrals for children with ASD who are presenting with intense anxiety. And this is because of the incredible instability, the disruption to their routine, and the uncertainty that the pandemic caused with the repeated school closures and then reopening the schools, repeatedly telling the children to go home if someone tests positive. This really throws children with ASD. Sensory processing differences can also cause a lot of anxiety. So things like loud noises, if the child's hypersensitive to sounds, that can cause a lot of anxiety. In boys in particular, in early childhood, this anxiety can show in the form of meltdowns and aggression and challenging behavior. Whereas with girls, they tend to withdraw and they might behave in a way that will get them sent out of class, just to avoid being in the anxiety-provoking situation. Another mental health condition that is quite commonly associated with autism in teenagers is depression or low mood. So this is much more common in later adolescence, when these young people start to realize that they're different and that this is a lifelong condition and there's not much that they can do about it. This can cause a lot of low self-esteem, low self-confidence, and cause depression. It's usually triggered by friendship difficulties or relationship difficulties, especially if their peers are getting on with their lives, making friendships, having relationships, and they feel isolated or unable to be integrated in their peer group. ADHD is not a mental health problem, but it is another neurodevelopmental condition which shares common risk factors with autism spectrum. So they commonly occur together. But inattention can be a very common difficulty in ASD without comorbid ADHD, without co-occurring ADHD. So it's very important to differentiate whether the child has both or if it's just ASD and the inattention is because of the high levels of anxiety or because of the sensory processing differences, because the management of each condition is very different. So how can we help? If autism is not an illness and has no cure or medical treatment, then why diagnose it in the first place? What's the point in diagnosing it if we're not going to be able to treat it or make it go away? So number one is because it can help the individual with autism understand themselves better. So a lot of teenagers in particular will feel different or be made to feel different by their peers or their teachers or family members. And they will go off and research various mental health problems or illnesses that might explain why they're so different, why they get anxious about things that other people their age don't really bother about at all, why they find certain situations very difficult when their peers seem to just sail through. And this can cause a lot of problems for them. They start diagnosing themselves with all sorts of problems. And if they transition into adulthood without a diagnosis, they will often get misdiagnosed with all sorts of serious mental health problems, including psychotic illnesses, because of how odd or awkward they might come across, and personality disorder. It's also very important to recognise autism so that parents and teaching staff can understand the child's behaviour better. So very often, especially with boys with autism, they will get labelled as naughty, misbehaved, or offensive, or disruptive, or defiant in school, when they don't mean to be any of these. This is just their way of expressing themselves, or their way of coping with their difficulties and their anxieties. So once they get the diagnosis, their behaviour can be understood within the context of ASD, and they can start getting the right help and support. We can also help by recognising that these children and young people with ASD have significant strengths that other people without ASD lack. So I expect everyone can recognise the people in these pictures, all of them very successful in their fields, because one of the major strengths of most people with autism is their ability to hyper-focus on their special interest or on the area that they're really interested in. Their attention to detail tends to be very, very high. So if they find an area that they're really interested in, and if they're encouraged to pursue that field of interest, they can become very, very successful, and they can be well integrated within that context. So autism, as I said, is a lifelong condition. The core features of autism aren't really going to change much. So it's really important that we understand and accept the differences that these children and young people have in their behavior, in their speech, their understanding of things. And because it's going to be very difficult to change them, or to change their core features, and it's not necessary, we need to be able to adjust our own behavior and our reactions to it.
Hello.
So, for example, if a child...
Okay, don't shout at me. You're angry. It's loud. Mm. It's really loud. Oh. Yeah. Was it all right?
Salwa, can you mute your microphone, please? Sorry, my dear.
Oh, sorry. Hold on a sec. Can you mute me, please?
Sorry, I have no idea how to do that. Sorry.
Okay, I'll do it. Sorry. I do apologize. I don't know what happened.
Fantastic, thanks.
So we need to be able to adjust our own behavior and reactions to children with ASD. So a lot of children with ASD can be very literal. They have very, very black and white thinking, very concrete in their understanding. So it helps a lot if we're very precise or specific in the way that we use our language when we communicate with them. It helps a lot if we're punctual as well, especially if they're really rigid about timings. And it helps if we give advance warning of any change, because of their difficulty coping with change and uncertainty. It can help them cope much better if you give them plenty of warning about when that change is going to happen, why it's going to happen, and how exactly it's going to look. Speaking directly to them on a one-to-one, rather than giving general instructions to a group, helps them a lot to grasp that instruction and then get on with what needs to be done. And a lot of children on the spectrum prefer to be spoken to in a low voice because of their sensitivity to sounds. adjusting their environment can also go a long way in helping to contain their anxieties. So adjusting their environment at home, at school, in church. So for example, giving them more time to do things, more time to complete their tasks, using visual aids. So children with autism tend to understand things much better if they're presented to them visually rather than verbally. So if they can see the instructions written or in the form of pictures, it helps them grasp the instruction much better than if they hear it, if you just say it verbally. Things like ear defenders can help if they've got hypersensitivity to sound, and giving them fidget objects, sometimes just something to fiddle with whilst they're in a situation that they find quite anxiety provoking, can help contain that anxiety and help them concentrate a bit better. Sameness, so avoiding a lot of change or moving furniture around and changing their seating plan. Sameness helps contain their anxiety as well. Offering them a safe space, so for example at school, at home, or in church, just somewhere they can go, be alone just for a few minutes when they find that they're becoming a bit too overwhelmed with anxiety or frustration, just to go calm down and then come back and carry on with what needs to be done. So this was just a whistle-stop tour on ASD. I know there's so much more that we can talk about when it comes to ASD. So these are a couple of links that you might want to check if you want to find out a bit more, and just a couple of books that you might find interesting to read. And I think Father Peter wanted us all to have a bit of a discussion about how we can help children and their families with in our own church communities if they have ASD, and how we can maybe think about how we might be able to change ourselves and our communities so that we're more welcoming and more containing really for these families. Thank you very much.
Thank you very much. That was very helpful indeed. I'm just going to stop the recording. Oh no, I'll keep the recording going during the discussion. Okay, fantastic. Let me ask a question first of all, and please, we need to have some questions and some discussion. I want to ask, you say that we shouldn't speak about people being more or less autistic. So how do we express the sense that a child might come to my church in Liverpool who is entirely unable to communicate, doesn't even seem to know I'm there, is extreme in their situation. You don't want me to speak of autism as a disability. You don't. How do I speak about the difference between someone who's a little awkward and serves with me in the altar, and someone whose mother is in tears because she has two children who are completely non-verbal and not able to do anything, it seems. How do we as a church express that properly?
Thank you, Father. So if there is a significant speech delay, then perhaps it might be worth assessing the child for a learning disability or a co-occurring intellectual disability. So being nonverbal or having speech delays is not a core feature of autism. So managing an intellectual disability or a learning disability is quite different from managing autism on its own. So if a child is presenting with both conditions, the learning disability and autism, they need to be managed in a bit of a different way from the way that you would manage a child who's just presenting with autism without the intellectual disability.
Yes.
But it doesn't mean that this child who's got the intellectual disability has severe autism. It just means that they have autism along with an intellectual disability.
Yes. Okay. So how should we? So should we then avoid all sense of? I remember when I was speaking to you at the day retreat, you very, very helpfully spoke about how, and perhaps you could say a bit about this in your own work. You're not interested so much in diagnosis, and of course I'm not as a priest, but you said you were interested in solving problems. Can you say a little bit about that? Because I think that that's a fundamentally important way for us to view not only children who have been diagnosed with autism, but all of the people in our community. How do you feel as a professional, and what is your advice as a professional to us as Christians to think of helping people with problems rather than thinking that somehow we can start to diagnose one another?
So I think it's very important to see the individual or the child as a child with a problem rather than a problem child.
Yes.
This problem has to be seen in the whole context. So we have to look at the child within the context of the family, the upbringing, the environment. We have to look at the school, what's going on in the school, how's the school environment, how's he being managed in school, how do the teachers react or respond to the child, how are the child's peer relationships, and we have to look at ourselves in church, how we respond to the child, how we manage the child, whether that's increasing the problems perhaps, or whether it's helping reduce the problems. So I suppose rather than giving a label, we need to understand the child as a whole.
Yes. And also, as you're, I don't want to hog things, but I do want to start the discussion. And I've been thinking about this a long time. As I have tried to learn about autism myself a little, you know, and I've done a few small, short courses, and they've been very helpful to me. I start to see that actually some of the things you've even described in your presentation today about how we support people, the idea of being punctual, the idea of making our instructions very clear, I'm starting to feel, and please comment, I'm starting to feel that these are ways we should be dealing generally with most children. You know, we should be becoming a community that is ordered and organized so that we are not adding to the stress even of children who have not been diagnosed with autism, or adults either, you know. So when Amber Misael says we are to start at the time we have said, you know, and Amber Angelos says the same, what I'm trying to say is I feel that we need to implement some of these things you've spoken of and some of the other practices that professionals introduce generally, you know. Be clear in our instruction, start on time, not introduce changes willy-nilly so that no one knows what's happening. Allow people to take their time and not putting them under pressure. It could be an older man walking to the lectern to do a reading. We don't make anyone feel, you know? So this is my question to you. Is there an advantage in us implementing many of these things generally and not thinking this is special autism treatment, but this is how we should be normally, you know, to reduce the stress level for everyone?
Yes, I think that's really important, but also because we all have families with children who have ASD in our congregations.
Yes.
We're not always, or not all of us are aware of these children. I think partly because perhaps of the stigma. So perhaps families try to hide, or perhaps they don't even bring the children to church because they don't want other people to notice. But if we make our church communities more ASD friendly, in the way that you've just described, Father, I think it will be much more welcoming for these children and much easier for these families to then integrate their children into the church community without emphasizing their differences, because these differences will only come to light if the child's stressed.
Yes.
So if the child is allowed to do things at their pace, if the church environment is as quiet and calm as possible, as ordered as possible, if everything is on time as much as possible, the child's much less likely to show their distress, much less likely to show their anxiety or frustration, much more likely to like coming to church. Whereas if we're incredibly chaotic and everything is out of sync and not in order, and everyone's talking over everyone else, this becomes an extremely difficult environment for children with ASD.
Yes. I'm just thinking, as you were speaking, you were saying again about how autistic children like things to be on time. They like to know the order, you know, and I'm thinking in my mind already, I want to do a card that shows pictorially what's going to happen during the liturgy. But what I was thinking of is that there's one or two boys serving with me in the altar, and they're both autistic, you know, and they often say to me, they often ask me about the time, you know, and I imagined, before you made that clear, I imagined concentrate, boys, you know, we keep going till we finish, you know. But I'm starting to realize that this also, they do some flapping. I'm used to that. They do lining up of candles. I'm used to that. But now I realize that even when they say, how much longer is it Abuna? When do we finish Abuna? This also is an expression of building anxiety where it seems that it's never going to end. I remember being at a liturgy in another place, I won't even say the name, not in our diocese, and I was still becoming Orthodox, you know, and we got halfway through the service and I thought it was about to end, and then we seemed to carry on, and it was in another language. I felt a little bit like that. I had no idea what was happening. When was it ever going to end, you know? So I'm starting to see much more clearly that the characteristics of many of the children in our churches are not just random, but they are expressing, they are proper expressions of how they are feeling without being able to communicate in another way. I have a question here, and others can ask as well, but let me give it to you first to answer it from your perspective. Any specific tips for Sunday school servants who tend to have limited time in the classroom, etc.? What is the best way to help a child like this and their family? I guess when we have a clear, this is what we're trying to do today, I have this and this and this, how do we make it better and not worse? Please, anyone who wants to ask a question, either do it verbally in a minute or post it here. Sorry, that question then first.
So every child on the spectrum is different, and each child on the spectrum will have different needs. And I suppose the best person to ask would be the mum or the dad, because they know the child best. They know what they can cope with. They know what they can't cope with. They know what makes them really anxious and what will make them not want to come back to Sunday school and what will help them feel a bit more welcome. So the first step, I suppose, is to ask mum or dad, how can we help in class? And I suppose general tips are what Father Peter just mentioned, is being on time. If you're saying to the child that Sunday school is going to last for half an hour, if it then lasts for 45 minutes, this is going to cause a lot of anxiety for a child with ASD, and they might not come back because they won't trust you to keep time the next time. Being a bit more precise in the way that we talk, in the way that we use language to communicate with them. And perhaps if we want them to participate in something, or if we want that particular child to carry out a task, we need to look at them, speak to them on a one-to-one basis, rather than give the instruction as if it's general to the whole class. Make sure the child understands that this instruction is for them, and give them the extra time to complete the task. So no pressure, don't put any pressure on them. And it helps a lot not to put the children on the spot, so to get them to volunteer as much as possible.
Is it also an idea in our Sunday school contexts, maybe with younger ones, maybe with older ones as well, just to have a chart at the front, maybe one we use every time, that says in pictorial form as well as words, we're starting with this, then we're doing this, then we're doing this, then we're doing this. Is some of these things, they seem, do we really need to do that? But it does seem that that's helpful.
It's extremely helpful, especially for children in primary school. So most children with ASD have trouble with auditory processing of information. So processing information that comes through the ears is much more difficult than processing information that comes visually. So if you give an instruction verbally, it might not sink in straight away. But if you show it to them in a picture, it will sink in straight away, and they'll be able to carry it out much better. And that will improve their confidence.
Fantastic. That's something practical we can think of doing. Salwa, do you want to ask a question?
Yes, thanks, Abuna. Hello, Maram. Nice to meet you. Is my voice audible properly? First, sorry about earlier. I didn't realize my mic was on. One thing about this whole discussion, as somebody who actually myself, I'm on the spectrum. I've been through church, I've been through church services, I have kids who I'm sure have traits, and so on. It is easy with a talk like this, and I'm really grateful for you and Maram to do this. Aren't we overdoing it a bit, in the sense that you know, the guy is autistic, so what? He will or she will go to Sunday school, do things, and all they need is a few adaptations. Because as somebody who also works with autistics, all you need with certain people is some adaptations, and that's it. Also, you've discussed autism as a thing that needs tackling. That is, I mean, some of us, and I speak for a lot of people, we do not believe that we are mentally ill. We are not on medication. We are not, we do not need to be told or felt that, oh, you're autistic, sort of thing. What are we going to do as a Christian society to incorporate, to include people just as people? I mean, Jesus himself accepted people as people. He didn't say to the woman at the well, oh yes, you poor ickle diddums, or something like that. Shouldn't we as Christians be incorporating and including people? Yes, raising awareness of autism. I would have loved people to, when I was in an age where I needed the help, I would have loved people to be aware of the fact that I'm extra sensitive. I am hypersensitive in certain respects. My sensory, whatever, all the stereotypes that people associate with people on the spectrum. But as Christians, as well as incorporating all this, shouldn't we just talk about people as people? Sorry, I will try to just say one bit. In the Anglo-Saxon culture, and possibly, maybe in Egyptian culture as well, people tend to exclude something, pinpoint something, label it, diagnose it, and put it in the DSM or the ICD, and it becomes a thing. Shouldn't we as Christians try to steer away from that? Thanks.
I'll let Maram speak, but I think that's fairly much the opposite of what she said, to be fair, because she began by saying autism is not a mental illness. And everything that we're talking about here is entirely to do with how do we help people who have been diagnosed with autism or have not been diagnosed with autism participate more fully in our church life. And especially for a child, if a child requires some reasonable adaptations that we're talking about, then that's what we need to do, not because they've been labeled and we think that's a nice thing to do, but because we want them to participate. Maram, how would you answer those comments?
Yes, you're absolutely right, Salwa. It's definitely not a mental illness. It's not an illness at all. But a lot of children on the spectrum, every single child on the spectrum or individual on this, sorry, I'm a child psychiatrist, so I don't see any adults with ASD. That's why I keep talking about children on the spectrum. But any individual on the spectrum is different from the next one on the spectrum. So like you said, some people on the spectrum might not struggle outwardly. They might be able to sail through without any problems and without needing much adaptation in their environment. But other children on the spectrum, including some children in our church congregations, they really struggle, and it might go, providing these adaptations just in the way that we respond to them and in their environments might go a long way in helping them integrate in the church community and enjoy fellowship with everybody else in the church in a way that perhaps they're not getting in school because they're struggling to cope in school. Mental health problems are, certain mental health problems, especially anxiety, are a lot more common in children with ASD than children who don't have ASD. So it's just this cohort of children with ASD that I suppose we're talking about supporting. But of course, if someone's on the spectrum and doesn't want anybody to know that they're on the spectrum, that's absolutely fine. That's something that we always tell a child before we even assess them that, you know, if you want to be assessed, if you do get the diagnosis, you don't have to share it with anyone. It's entirely up to you who you want to share it with. If you think that it will help you get on better at school, if you're better understood as somebody who's on the spectrum, you can share it with a school. But we as professionals don't share it with anyone without the family's permission.
I like to think, tell me if I'm wrong, please tell me if I'm wrong. But I like to try and think of it from my perspective as a priest, a pastor, that I am the one with the problem, not the child. And again, I'm dealing especially with children, serving in the altar, running around the church. I am the one with the problem. I have failed to understand that they are communicating with me as best they can. I don't feel very happy here, Abuna, you know? And the fact I keep disappearing off isn't because I don't understand what's going on and I have no respect for the altar. It's the only way I can cope with the stress I'm feeling, the anxiety I'm feeling. I want to put myself as the one who has failed to understand. And so I am not trying, following on from Salwa, I'm not trying to fix at all anyone else. I'm trying to make it better for them to be able to participate more fully. And that's why I'm concerned that with all of the different subjects we're going to consider in this series, we are not trying to become lay psychiatrists diagnosing people. You know, that's not what we're interested in. But we want to become aware of problems that people are facing so that we can help them and encourage them, be respectful towards them. You know, I have had a boy in my altar, and when he was, it's interesting you say that it tends to die away. A couple of years ago, he would stand beside me flapping his arms, you know. Now he doesn't. He lines up candles on the altar in a neat row, you know. But he loves to participate. He has, as you say, he has no learning disability. That's not what autism is. He reads fluently. He knows exactly what he's doing. He wants to help, but there's little things that I've had to learn with him. When I've said something to him and then I change what happens, he's very disturbed by it. When I've said to him a while ago, you are going to be the only one to serve with me in the altar, that was okay. When I let a little boy of 4 in to serve with us, he couldn't understand what was happening, you know, because I'd said to him that he was the only one serving, you know. I understand slowly that I'm the one that needs to change. I'm not trying to change him. I'm trying to make it easier for him. And I'm really having to learn. And I am a father and I am a grandfather and I know what naughty children are like. You know, I'm having to keep saying to myself, this isn't naughtiness. This is naughtiness, but this isn't naughtiness. You know, this is a condition that I have to support. And I feel that's what I want us to learn as a church. There are naughty children, and many of them are our own, you know, and we've been naughty children. But there are also many children and adults who are struggling in a social setting such as the church. And it's our responsibility to become aware of their needs as far as they want us and need us to help them, and to support them in that. Let me ask you, what could we do? What should we do better? You're the wife of a priest. You're a Coptic Orthodox Christian. You know our community. What do you think are the main problems that often a family with a child diagnosed with autism face in the church? Not just the obvious ones even, but the ones that really are hardest for them. And what can we do as a church community? If you could think of 1, 2, 3 things that were the most important, what can we do to better support families and people with autism?
So I can think of a couple of families in our congregation where the children have ASD along with an intellectual disability, some milder than others. And I think what they struggle with the most is that if the child makes the slightest noise in church because they're getting a bit overwhelmed or because they're just responding to the hymns or the loud prayers in their own way, everybody looks and everybody points and the priest stops praying. And it becomes really, really awkward for the child and for their family. Perhaps the family much more than the child, because they're much more aware of their child's difference. So I think if we're a bit more tolerant, I suppose, of these differences, this is something that we're not really going to be able to change in the child, nor should we try to, like you said, Father. But what we need to do is change how we respond to these behaviors and recognize that this isn't naughty behavior. The child isn't loud because they're naughty or because they're deliberately misbehaving. They can't help being loud. This is their way of responding to their environment. So just, I suppose, being a bit more aware of why the child is doing this, and not making the family feel awkward or unwelcome.
Let me, before I ask you, I'll press you again for a couple more ideas perhaps, but if a family feels very anxious coming to church, as I can imagine they must, does the child also feel that as well? And does that add to their anxiety?
Definitely. So the mother's anxiety in particular always rubs off on the child. But I think what's really important as well, which we tend to forget about, is the siblings. So if a child with ASD or an intellectual disability is kept away from church because of that, that really affects the sibling as well. So they either reject the church because the church has rejected their brother or sister, or they feel very embarrassed by their brother or sister, which obviously causes a lot of issues within the family. So we shouldn't forget about the siblings. And a lot of the time as well, the siblings get a lot less attention from the parents or the caregivers, because the child with autism is just taking so much of the parents' time. So that sibling needs a lot of our attention and a bit of extra care from the church as well. And I suppose we need to be a bit more welcoming of that child, the sibling, I mean.
So is that something that we could be, a month ago, we were thinking about loneliness and how we have a responsibility to look around us in the church situation and also outside of the church situation. Can we message people? Can we be in contact with people? Who is the person sitting on their own quietly in the meal after the church? You know, we have a responsibility. And we thought about how we might have a ministry team to do that. But Abuna very wisely said, it's not something we can subcontract out to other people. You know, yes, I can ignore the lonely people because we have a group of people taking care of that. You know, is this also something that we need to be deliberately, those of us who are in this group, aware? You know, we should be deliberately focusing, especially as you say, on the children, all the wider children of a family, making a fuss over every child, not just the child with autism. Is this something we should be positively, deliberately doing?
Yes, definitely. I think it's part of our duty, isn't it? These are members of our congregation, and they should feel welcome just like anybody else. So some mothers will find it helpful if you know, someone offers to sit on the same bench, for example, and help out with the child, but it's got to be someone that the child knows, because if it's someone who's not familiar, it will increase the child's anxiety. So getting close to the family, getting to know the child, getting to know the siblings, and then being together in church, not necessarily sitting on the same bench, but perhaps just including them in your group in church, and then gradually integrating them into the wider group.
And I suppose also from what you say, being more tolerant of aberrant behavior is the wrong word. Behavior we're not expecting or necessarily planning for, but being willing, be able to understand that a child might get up and leave, not because they're naughty, not because they're disrespectful, but because they need a break. It's just getting too much, you know, or they don't understand they're not allowed to get up and just leave, you know. It's difficult and complicated for us to keep these two modes of activity in mind, isn't it? This is what I'm trying to do. I'm running a Sunday school class, but I also need to be aware that not all of my children are able to respond in the same way. And when they respond differently, I can cope with that, you know. This is part of the challenge of our service in modern times. Would you also say that in your experience, the prevalence of autistic characteristics is increasing, or is it the same as it has been for a long time? Is our society exacerbating these conditions, making children more anxious than they might be in perhaps a rural situation where everything is the same every day? Does our very Western society make it harder and make autism more visible?
So our society doesn't cause autism. we can't do something to cause autism, but yes, we can, our behavior can worsen the anxiety or the co-occurring difficulties alongside autism. So the confidence, the child's confidence, the level of anxiety, the child's mood or emotional state. Yes, of course, the way that we respond to them and the way that we behave around them, whether we accept them or perhaps make them feel a bit more awkward, all of that will affect how they behave and how different, I suppose, they come across. The prevalence of autism is estimated to be 1 to 2% at the moment. When I first started training in CAMHS, it was thought to be 1 in 1,000. And that was about 12 years ago. But now it's believed to be 1 to 2%. And it's not thought that it's not just an increase in the awareness or our ability to diagnose the condition. There are factors that are actually increasing the incidence of ASD.
So to be honest, we should expect that within our communities, every one of our congregations of any sort of size will have several people either diagnosed with autism or undiagnosed, dealing with characteristics of autism. And we are very, very likely always to have more and more, especially as people come and join our church from outside. We need to be prepared to respond in a Christian manner. Nancy, your hand has been up for a long while. Sorry.
No, thank you very much. I actually got 2 questions regarding to dealing with families that have a child with autism. As a parent or as a grown-up, how can we support these families? I know you covered a bit, but some families are really sensitive even to mention it to others or to let others know about this situation for their kids, afraid of labeling them or treating them in not in a nice way. So as a grown-up, sometimes for the sensitivity, we try to avoid talking or helping just because we don't need to press or on these families. So how to introduce helping without affecting this sensitivity? This is the first question. The second question regarding to our kids. So I think that kids with autism need to be welcoming from their bearing as well, from their bears with other kids. So how to make our kids aware to play or to communicate with kids with autism in a very nice way, in the church or in any groups, without, of course, without saying it, the situation, otherwise they will be naming each other. So how to introduce that to the other kids as well. Thank you.
Yeah, thank you, Nancy. Very important questions, very tricky as well. So the first question was about how to support parents, despite the fact that they might have sensitivities around the stigma. So this was the main point, I suppose, in giving this talk, is to try and raise awareness on what ASD is and what it isn't, and that it isn't something that we need to be scared of or embarrassed of or ashamed of. It's just a difference. Children who see things in a different way and perhaps think about things in the world in a different way. So I think our approach to the families need to be very sensitive, but also very, I suppose, casual in a way, in a sense, where we don't make it seem like it's a, like it's a big deal or something that they need to be really worried about, or a difference that really needs to be emphasized. But I suppose we need to approach it in a way that helps reduce this emphasis on the difference and helps the family see that, the child is still part of the church community. They've got lots of strengths. They've got lots of things that they can add to the community, that they can bring into the church community, and encourage those things. Perhaps if we get close to these families and get to know these kids a bit better, we might be able to spot these characteristics and try and build on them, or encourage the Sunday school teachers then to try and build on these strengths. getting their peers to be a bit more friendly with them might be a bit tricky with primary school kids, because they just do their own thing, don't they? They don't really bother about niceties and things like that. But we need to make an effort, I suppose, to get the child to join into the activities. Perhaps if there is a child in the group who is extra sensitive, extra nice, kind, quiet, calm, gentle, girls in particular are really good at that job, we can perhaps assign them as a kind of a buddy to that child who might be able to then integrate this child into the wider group. So in your Sunday school group, for example, there must be a girl or two who are quite mature, quite sensible. You might speak to them and say, oh, look, without mentioning ASD or any difference or anything, look, this child doesn't come often, and we need to encourage them. We need to be more welcoming of them. So can you take that role? Can you help them to make friends with the others? Can you help them to play with everyone else? But obviously, we need to also be sensitive to what the child can tolerate and what they can't. So we need to be asking the parents about that. But some children might not really want to play in a large group. They might just want to play with one other individual. And if you try to integrate them into a larger group, this might really increase their anxiety, and they might not want to come back again. So we need to check with the parents first what might suit this child and what would definitely not suit them. Sorry, does that answer your question?
Thank you. Yes, thanks a lot.
And Amir?
Hi, Abuna.
Hi.
I think I missed the first part of the lecture because I went late. It's a small suggestion I like to see in our churches. What if we have special Holy Mass for our children every 2 or 3 months, just educational? And I believe all our kids have an element of a degree of some autism or some cease behavioral points. So if we have educational Holy Mass for the children every meanwhile, different from the adult Mass, giving them some special education in this Mass, and let them we are all kids, we are all learning. That's my point, if we can do that in our churches.
Yes, certainly. That's a fantastic idea. And it's one we've done in Liverpool, in Stockport, in many of our churches. COVID made things difficult for a while. But I think we do try to have liturgies in our different churches, especially focused for the children. It does make a difference. I know that the children like to see how the altar is dressed and what is the charcoal inside the Sharia, and they can ask questions and not give answers about the meaning of the different parts. I think that's a great idea. Dr. Maram, is there scope? There is a group on Facebook called Koinonia for Exceptional Children, or Families with Exceptional Children, which supports families with autism in some of their children and other disabilities. Autism is not a disability, but other learning disabilities as well. And they have liturgies just for people with problems. Is that a good way to go, or is it better to have a liturgy for children where there is more tolerance, but all children? What's your view on that?
I think it depends really on the child again, Father Peter. So even with schooling, with education, some children are able and in fact flourish in mainstream schools with just a little bit of adaptation and help from the teachers to integrate them and social skills trainings and things like that. Whereas other children can't cope in mainstream school with ASD, and they flourish in specialist provisions where everyone else is on the spectrum as well. All the other kids are on the spectrum. So I think it depends on the children really. If certain children will not be able to attend the a liturgy with a large group of children because of the noise, because of just how overwhelmed they're going to get with the crowds, and the anxiety about being in such a large crowd. Whereas other children might, with some help and some support, really love that because it's an opportunity to perhaps socialize in a safe environment where they're not going to get bullied or targeted in a way that perhaps they are in school. So it depends on the child. And again, I think we need to be checking with the parents about these things.
Fantastic. Yes. So we must, you have said, and we must remember that autism spectrum disorder is different in every person. It's a spectrum disorder. You don't have more or less of it. You have it, but differently. And we have to understand that we cannot have, this is the solution for autistic children. We have to look at every one of our children, whether they're diagnosed as autistic or not. And we have to be asking ourselves as servants in the church, how do I help this child to participate in the life of the church, to experience salvation for themselves? How do I help this child experience salvation? And the answer must be different. Abuna, is that you under the name of Bishoy?
Hi, Abuna, how are you? Thank you for preparing the talk, and thank you, Maram, for the talk. Can you hear me, Abuna?
Yeah, I can hear you, my father.
Yeah, thank you for preparing this one periodically. Thank you very much. Abuna, and Maram, I just have an idea. I don't know if it is right or wrong. In all our churches, is it right to make a room for the babies and the crying babies and the naughty babies or something like this? Or this is an idea that we isolate them and some families can't touch this area or go to them? Is it nice to prepare a room for that or to leave it with the other families?
Father Peter?
We have in Stockport room, we called it crying room.
Yeah, we have the same in Birmingham.
People can do what they want and like what they want, but I don't like crying rooms. I can understand a safe place where a child can go. But many of our crying rooms are noisier than the church. So they're of no use to someone who is upset. It makes them more upset. I really believe myself that most children belong most of the time in the church. A child who is very, very agitated, the parents might want to have somewhere to take them, but it should not be a room for all of the children. It should be a room where you go for a few minutes if you need to, and you have quiet, and then you come back. If you want to feed your baby, you can go there for a few minutes and come back. But my view is strongly for myself, though I do not speak about it, but all of our children belong with all of us in the liturgy, and we have to work out how we do this. And sometimes that means it is noisier than we might wish because our children are struggling, some of them, but they belong here in our community. So my view is if it was a quiet room, then it is a good idea perhaps for someone to go to calm down, even an adult to go just for a few minutes. But if it is just a room where all the children are sent, then I don't think that's good at all. But what do you think, Doctor?
I agree with you, Father Peter. I think it becomes really difficult then to decide when the child comes out of the crying room and starts attending the church, because the child grows up, get used to being in the crying room, used to being separate from the main liturgy. And then for the parents then start saying, oh, now you're old enough to attend the liturgy. It's something new for them, something they're not used to. And I think that's not very healthy. But I think it's also up to us servants to involve these children in the liturgy, in the service, so they it's as quiet as possible. So both girls and boys. So I think in Nottingham Church, they're absolutely brilliant at doing that. They're really good. They've got both deaconesses and deacons on either side, and it's very well organized, and all the children feel involved in the service. So you don't get much disruption. And you don't get crying rooms there. I don't think you've got a crying room in Nottingham. Nancy will know, but I don't think they do. But yeah, I don't think a crying room is a great idea, really.
Thank you very much.
Does anyone else have, I don't want to keep Dr. Maram for too long either, but that was a wonderful, wonderful presentation. And we have some ideas here to put into practice. If we were to visit the websites that you gave us at the end of your presentation, would we find more helpful information for servants in a general way to gain better information? I have just finished, it's nothing, but I'm only saying it because others might wish to do it. I have just finished a 3-month course called Understanding Autism. I did it with one of the colleges of further education. It is nothing, you know, but it was helpful for me for 3 months. To be reading every week and writing some answers every week to gain an understanding of autism. And I don't have much of an understanding, but it is more than it was. I really am committed myself to learning more and more about the struggles that all of us are going through, so that we can be better servants of the people that are struggling in our churches. And all of us will discover at times we are one of those who struggle. All of us will discover at times we have someone in our family who is struggling. So we want to build the church, the diocese, the congregations that are able to support people who struggle now, because the time will come when we need such a congregation, when we need it for our families. You know, we are being selfish in a way, trying to prepare the church for our own needs. Even as I get older, to be very serious, you know, I could get older and start to develop all manner of illnesses and even mental conditions associated with age. We need to have a church that is welcoming to people. One of the talks we'll have later on is about Alzheimer's and dementia, and how we support people with that condition in the church. You know, from the youngest to the oldest, we need to become the church who supports those who have these struggles. And I really do desire, in having these monthly meetings, that somehow in God's will, we become a center of excellence. We do it properly in our diocese. We take whatever effort is required to care for every member of our congregations, especially those who are struggling in different ways. And in these series, we are focusing on mental health. And in some of the meetings, we will focus on how to have a good mental health. We are not only looking at people who are struggling, especially. But this is very important to me, and not as just some fad I have got, but because I feel it's part of what it means for us to be the Church of Christ in the world. As more and more people are struggling, more and more people are facing anxiety, stress, loneliness, you know, all of these, depression, suicidal thoughts. We must not think our congregations are somehow excluded from these. I am in touch with Orthodox Christians, members of our Coptic Church, who struggle with suicidal thoughts even, you know, with severe depression, with overwhelming anxiety and stress. And it's not enough for us to imagine that good Christians don't face these things. Very many devoted and committed Christians also struggle with these things. And I desire, and I believe it's God's desire, that we become the congregations and a diocese who tries to provide the necessary support. And we have so many people in our own congregations who are professionals in this field, and we have so many wonderful servants and parents and elders in our church who love Christ and want to serve the community. So let us continue with this series of talks. Let us continue to try and educate ourselves, and especially, I would say, let us try and put something into practice next Sunday, next weekend. Let's try and do something a little bit different. Let's look at the children, especially around us in church on Sunday, and try and understand them in a different way, and try and see how we play a part in their lives to help them participate. I have one little boy, and he is autistic, and he will not receive communion from me. He comes up and then he says, no, no. And I will not force him to receive communion. I say to his sister, who is about 13, we will try again next week, you know. But he comes, when he comes to the stand at the front, he says, sticker, sticker, because he knows I give out stickers. So I know that I have a connection with him. And I don't want to give him a sticker when I'm giving out communion. He comes back, but I know that he is willing to communicate with me in this way. And so I am full of hope that one day he will allow me to give him communion, you know. But I am slowly learning the problem is mine, not his. He cannot change easily how he is, but I can change things for him. I can show him that he's always valued, always welcome. I can always greet him with a smile, you know, without putting any pressure on him to do anything in return. So these lectures are very important. I'm glad that we've had 22, 24 people here today, and we should try to spread the word and increase the numbers month by month, because these are very important topics we're considering. Does anyone have any final comments or questions? Then let me pray a very quick prayer, because everything we do is spiritual. Everything we do is in God's presence, and we hope to achieve everything good by his grace. Heavenly Father, we thank you for all of the things that we have learned today. And we thank you that we have gathered together as those who are filled with your love for others and desire to know better how to serve them. We thank you for all of the instruction we've received from Dr. Maram, and we pray that you will help us to see how we can put it into practice. We pray that as far as possible, if we do not have an increasing knowledge of this particular condition, we will try to make some effort to increase our knowledge day by day. But help us as we come to serve week by week in the congregations, to be more aware of the needs of others around us, not only with autistic spectrum disorder, but all of the needs of all of our people. Help us to be more concerned with others, more tolerant, more gentle and compassionate, more patient, more willing to allow others to express themselves as best they are able. Help us to present ourselves as the servants of all in your love and through your strength and grace. And hear us now as we lift our voices to you, our Heavenly Father, and pray, saying, Our Father, who art in heaven, hallowed be thy name. Thy kingdom come, thy will be done on earth as it is in heaven. Give us this day our daily bread, and forgive us our trespasses, as we forgive those that trespass against us. And lead us not into temptation, but deliver us from the evil one, through Jesus Christ our Lord. For thine is the kingdom, the power, and the glory forever and ever. Amen. God bless you all, and thank you for attending today. I hope you all found it as helpful and inspiring as I did. And thank you again, Doctor, for your presentation.
Thank you very much.
Thank you. Thank you very much, everyone. Thanks a lot.